Dispense Magazine podcast. I'm your host, Sven Hosford. Dispense Magazine seeks to enhance the conversation between patient and physician about medical cannabis. Whatever you and your doctor might talk about, that's what we'll talk about here on this podcast. Over 70% of Americans will experience a traumatic event in their lifetime, and 20% will develop some form of PTSD because of it. So says Sara Makin, a mental health specialist with offices in Pittsburgh and New Kensington. She uses a variety of new methods, including medical cannabis, to treat PTSD, addiction, and other mental health issues. A PTSD diagnosis from her can help you get certified when you meet with a certifying physician. But that is only the start of the healing work she can do. I recently sat down with her to discuss trauma, PTSD, and cannabis. Here's our conversation. So we're here today with Sara Makin and her office on the 18th floor of the investment building in downtown Pittsburgh. Welcome.
Hello, I'm so excited to be here. Thank you for having me on.
Thank you for being here. So we want to talk today about PTSD because this is a specialty of yours.
Yes.
Can you describe, just real quickly, describe your practice and kind of what you do around that topic?
Yeah, absolutely. So our practice is called Makin Wellness. We are a premier therapy and coaching center. We currently have a location in downtown Pittsburgh and downtown New Kensington and a virtual office as well. And we specialize in mental health, addiction, trauma, and relationship therapy. And we are very holistically focused and tend to have a lot of natural things incorporated into the treatment as well. And we have been open for it'll be a year in August.
Oh, wow.
So,
congratulations.
Yeah, thank you. Yeah. So we're coming up on our first year, and we're really excited about that.
That's excellent. So let's talk about PTSD. This is a term that people throw around a lot.
Yeah.
And maybe don't quite understand exactly what it is. So the core of it is trauma.
Yes.
So describe what is a trauma in the basic terms.
Mm-hmm. Well, trauma is anything that someone considers to be like a really negative event. It's really challenging because it's such a subjective term and has such subjective meaning. Like, for instance, one person might be in a car accident and they're completely fine. Like, they don't even think twice about it. It's not something they really consider thinking about again, versus someone else who experienced the exact same thing is really traumatized and is anxious every time they're driving and, doesn't want to drive or makes major lifestyle adjustments in order to not drive. Mm-hmm. So it's so subjective, and it really depends on the person. If they perceive it to be a trauma, it is trauma.
So it's really what the individual perceives is what determines whether it's considered a trauma or not. It's not any external definition of, you saw a dead body or almost were killed or anything like that.
Yeah, and there's different types of trauma. Like, even just seeing something on television can traumatize someone. There's vicarious trauma, where if you hear about someone that experienced something terrible, it can traumatize you. There's all different types, and at its most basic meaning, it's all what you interpret as trauma.
So this term we use, PTSD, the D actually stands for disorder. Mm-hmm. And a lot of people I know are pushing back and saying, no, it's not a disorder. It's just post-traumatic stress. It is a normal function of the human body. Mm-hmm. How do you feel about that?
It can definitely be a normal reaction to an abnormal situation. The biggest thing with post-traumatic stress versus PTSD specifically is that post-traumatic stress will go away pretty quickly. It's more of a increased stress after the event happened. PTSD is something that's a little bit more long-term and a bit more severe than just experiencing stress.
Okay, so there is actually two different things then.
Yeah.
Okay. How many people do you think actually have, what percentage of the population do you think truly does have some form of PTS or PTSD?
Mm-hmm. Well, actually, 70% of the adults in the U.S. have experienced at least one type of traumatic event in their lives. So that equates to about 223.4 million people.
So that's
just
most
in the U.S.
of everybody.
alone.
Yeah.
Yes. Yeah. So out of this percentage, about 20% actually go on to develop full-blown PTSD. So this is a very common thing, and especially with all of these different things that are going on right now in the world, people are more traumatized than ever.
Mm. So anytime we have a trigger, we experience something, and then I'm trying to give a definition here, and then we have a reaction that's well out of proportion to that trigger based upon some past event. That's kind of the post-traumatic stress. That's like stress is stuck in our body, and something triggers it, and it comes out in some way that's way out of proportion to the trigger. Is that
Yes.
pretty close?
Yeah.
Okay, good. I'm glad I understand that. So, one of the things you've said, and I think this is fascinating, is that most people that have some form of it don't even know they have it.
Yeah.
Now that's kind of scary because all of the
is.
talk that's been out there about it. And let's start with: is there a stigma around it? Do people feel like ashamed or embarrassed to have PTSD?
Well, I would say not only just PTSD, but a lot of different like mental health and addiction kind of like diagnoses. There tends to be kind of like a stigma around it, but that's something that I feel like is really changing now more so than ever. There's been a lot of mental health awareness, support kind of going around recently. So I feel like in the future that's going to be something that we're going to look back on and think, oh my gosh, we cannot believe that there was, such a quote unquote stigma around this. But it's something that I really feel like with time is
Because I
going
know,
to change.
coming from the military and I know several combat veterans, that kind of starts with they're ashamed to say they have any form of PTSD because it's not like there's a common feeling like, oh, you just buck up, just be stronger. If I was a stronger person, I wouldn't have this problem.
Yeah.
But that's kind of going away, is what
Yeah.
you're saying. Okay, well, that's good to know, too.
Yeah.
What are some of the symptoms that people have that are actually forms of PTSD?
Well, intrusive memories, so kind of like recurrent or unwanted distressing memories of the traumatic event. Flashbacks, which are you physically being present, but mentally experiencing and feeling like you're reliving the event again. So having bad dreams or having nightmares around that event, those are all intrusive memories. So avoidance. So symptoms of avoidance would be like trying to avoid thinking or talking about the event or avoiding the people, places, or things that remind you of the event. There can be negative changes in your thinking and mood, and some symptoms of this would be like just having negative thoughts about yourself or other people, having hopelessness, having issues with your memory. So, for instance, this could include not remembering important aspects of the event. You might have a hard time with relationships, feeling detached, or even feeling emotionally numb. You can also have changes in your physical and emotion reactions. So, for instance, being very easily startled, feeling like you have to be on guard, getting a overwhelming feeling of guilt or shame, or even having a hard time sleeping, a hard time concentrating, feeling irritable, feeling depressed, or feeling anxious. So it can manifest, trauma can manifest in so many different ways. And those are just some of the symptoms. Those are some of the most common symptoms of PTSD.
And a lot of these come on weeks or even months after the original trauma, is that right?
Yes.
So that makes it tough to tie it to any particular event sometimes. Yeah. What are the most common causes of trauma that you see that you're dealing with on a regular basis?
We see a lot of trauma that comes from family, childhood, relationships, and I would say those are the biggest causes. that we see
Yeah.
here.
Well, let's get to the good part. Let's talk about some of the methods that are used now. What were the traditional forms of treating trauma in, say, the last 5, 10 years or more in the past?
Mm-hmm. Some of the more traditional forms of treating it were just using more traditional talk therapy. So the clinician would just really encourage the person to talk about it. And unfortunately, that would re-traumatize people a lot of the times and was not the most effective. Nowadays, we have a lot more different methods that are a lot more effective and are evidence-based, which means that there's a lot of research behind them to support the efficacy of them. So, for instance, EMDR can be very helpful.
I wanted to get to that. Yeah, that's one of my favorites.
For treating trauma.
And just explain what the initials stand for and quickly how that works.
So EMDR is eye movement desensitization and reprocessing.
Reprocessing, yeah.
So essentially, whenever you look in different positions, it's accessing different parts of your brain. So what the clinician will do will have you move your eyes like left and right. They'll have you, sometimes they'll just sit and you'll have to follow their fingers. They'll move from left to right, or they'll have a machine that'll tell you where to look, and then you're doing therapy while doing that, and while you have your eyes in different positions and you're thinking about different things, it's supposed to help the healing process. There's that. There's tapping, which is one of the treatment modalities we use at Make and Wellness that has amazing outcomes. And
so, explain what you're tapping, why you're tapping there, and how kind of that works.
Yeah. So what tapping is, there's different forms. The kind that we use is called thought field therapy. And essentially, the philosophy behind that is that there's kind of like energy meridians within the body. And whenever you tap on different parts of your body, it'll access another part of your body and it'll help kind of release the trauma. Because a lot of times whenever we experience traumatic events, it's the energy of that's kind of stuck. And this helps to release it. So you're tapping on acupuncture pressure points to help release energy, essentially. And you're doing that while you're thinking about the trauma, and your clinician will tell you like what to say. You'll say it out loud while you're going through the algorithm, essentially, and that'll help reduce the negative emotion you feel that's associated with the trauma, and that really helps accelerate the healing process, and it's really, really helpful.
The whole area around tapping is so phenomenal.
Yeah.
Some people may be more familiar with EFT, Emotional Freedom Technique, which is another one of the tappings. Now, EMDR and the tapping, they are kind of predicated on the understanding that the trauma, as you said, the trauma gets stuck in the body, or it gets stuck in the energy field, or it gets stuck in these meridians, and that these movements, very gentle, simple movements and tapping can actually release that. To someone that doesn't understand quantum physics or how all of this works together, or Chinese medicine or Ayurvedic medicine, this sounds like total hokery.
Yeah.
It sounds like total, okay, you're just taking my money here. But as you said, these are evidence-based. There's lots and lots of science now to back these up.
Absolutely. And before I started at my practices, one of the things that I was doing is I was conducting research at Duquesne University. And so I have always been very data focused and very research oriented. And I would never talk about or encourage our clients or anyone to do something that I know isn't helpful. And I would say the biggest thing is just to try it out for yourself and see how powerful it is.
And the other nice thing is there's no side effects. I mean, there's
Absolutely.
virtually, literally no side effects to this thing, because you're not like pounding your points with a hammer or anything like that.
No, not at all. No side effects. There's no downtime. And the most amazing thing is that the results happen so fast.
Yeah. And then let's get to the one that we like to talk about the most, cannabis
Yes.
and CBDs.
Yeah.
Now that that's legal, have you started to incorporate more of that or help people get their cards, or how does that work in your practice?
Yeah, absolutely. Using cannabis it can be such a helpful tool for helping people who have experienced a lot of trauma. We definitely encourage that. And the other thing to mention too is because the treatment is so individualized, I mean, it's not necessarily appropriate for everyone, but for whomever can benefit from it, we suggest it, and the results have been really great so far. Our clients love it, and it's a great natural tool to help relieve stress, and it's really incredible.
Well, and it's also a good alternative for one of the old treatments we didn't talk about, which is good old-fashioned pharmacology.
Yeah.
Where they just pump you full of drugs. And I personally know several combat veterans that just hate the drugs that they get prescribed. And so cannabis is a way to actually help them reduce those amounts or even eliminate some of those. Have you seen that in your practice?
Yeah, definitely. People that before were trying pharmacology and it wasn't helpful for them, trying cannabis is normally a great thing, and normally have a much better response compared to pharmaceuticals. Having a dog or just any type of pet or animal that you really love, that in of itself can be such a healing thing. I've seen it help a lot of people reduce their anxiety and depression, and help them cope with their trauma as well. It's really amazing, and they know.
Yeah.
You know.
Well, it works really well with my kitty No.
Yeah.
Except when I step in a little pile of cat hurl in the morning, then I'm re-traumatized. But other than that.
Oh no. Got to tap on that.
Right. Let's get some tapping going. Is there any other kinds of newer methods or things you want to talk about as far as the tools in your toolbox and how you treat trauma?
Yeah, I would say tapping and cannabis are definitely our top ones that we use. We also use cognitive behavioral therapy, which essentially helps you go from thinking more negatively to more positively by helping you restructure your brain and develop new, more positive neural pathways in your brain. So we use that as well.
I've heard that's very, very effective just by itself.
Yeah.
And I've heard it's actually kind of a rebranded or using different terminology. It's actually basic mindfulness.
Yeah.
Which is just awesome, because mindfulness is not like the buzzword everybody wants to talk about.
Yeah.
So that's great. So it sounds like you have a wonderful practice here, a wonderful set of tools and toolboxes. And so they can actually, if somebody comes to you, they can speak to you about this, and they can obtain a diagnosis from you that can be used when you go to a cannabis certification doctor.
Yeah,
that's how the process works?
Yeah, basically what the process looks like is they come in and we can either meet virtually or we can meet in one of our offices, and we just basically go through the evaluation, and if the person meets criteria for that and it's something that they're open to, then they can absolutely receive that. And then it's not, the process doesn't just stop there, you know what I mean? It's still coming in to work on yourself and coming in to cope with the trauma and learn different things that are helpful and effective for them, as well as using the medical marijuana as a tool. It's whenever those two combine together, it's really lovely.
Oh, that's great. That's great. Well, let's give your. We'll have it on the website as well. But give me your vital statistics here, your digits, as they say.
Oh yeah.
People know. We can tell people how to get in touch with you.
Yeah, you can visit our website at www.makinwellness.com. That's MAKIN wellness.com. You can download our app. It's just the Makin Wellness app, or you can give us a call at 412-532-1249, and you can actually schedule online. The whole process is done online, and if you have any questions, you can please feel free to call us. And actually, we also text too. So you want to text your question, we can get back to you on that as well.
And I think it's awesome that you do the virtual visits. So really anybody anywhere in the world can work with you. Right.
We are licensed for therapy specifically right now, just in the state of Pennsylvania.
Oh, just in Pennsylvania,
yeah.
okay.
But for coaching, we can do that all across the world.
Okay. So, but specifically for people in Pennsylvania that are wanting to see if they even have PTSD or want to get that evaluation, so you're not guaranteeing that you're going to just swipe a thing for everybody that calls you.
Yeah.
But you definitely do, I think, have a real genuine desire to really help people, it feels like.
Oh, thank you. And that's very true. Yeah.
Well, it's been great talking to you.
It was great talking with you too, Sven.
All right. Thanks a bunch. And thank you for listening to this podcast from Dispense Magazine. Join us again next time for more conversation about medical cannabis. I'm your host, Sven Hosford. This podcast is a production of Mindful Medicine, LLC.